Hey everyone! Welcome back to our channel where we discuss all things related to health and wellness. Today's topic is about a condition that affects many expecting mothers, gestational diabetes. We'll be sharing some important information that you don't want to miss, so make sure to stick around until the end. If you're finding our content informative and useful, don't forget to subscribe to our channel and hit that like button below. It helps us create more quality content for you in the future. So, let's move on. Gestational diabetes is a type of diabetes that develops during pregnancy, affecting the way your body processes sugar. It can cause high blood sugar levels, which can lead to various health problems for both the mother and baby. If left untreated, it can cause complications during pregnancy and childbirth. However, with proper management, you can ensure a healthy pregnancy and delivery. In this video, we'll be answering some of the most frequently asked questions about gestational diabetes. While the exact cause of gestational diabetes is unknown, it is believed that hormonal changes during pregnancy can lead to insulin resistance, where the body is unable to use insulin effectively. This results in high blood sugar levels, which can be harmful to the developing baby. Other risk factors include being overweight or obese, having a family history of diabetes, and having polycystic ovary syndrome, PCOS. We'll be discussing more about the causes of gestational diabetes and the various risk factors involved. In most cases, gestational diabetes doesn't have any noticeable symptoms. However, some women may experience increased thirst, frequent urination, fatigue, and blurred vision. These symptoms are often mistaken for common pregnancy symptoms, which is why it's important to get tested for gestational diabetes during prenatal checkups. We'll be talking more about the symptoms of gestational diabetes and why it's crucial to get tested. The diagnosis of gestational diabetes is usually done between the 24th and 28th week of pregnancy through a glucose tolerance test. This test involves drinking a sweet liquid and then having your blood sugar levels measured. If your blood sugar levels are higher than normal, your doctor may recommend additional tests to confirm the diagnosis. We'll be discussing more about the diagnosis process and what you can expect. The treatment of gestational diabetes involves making lifestyle changes such as following a healthy diet and exercise plan, monitoring blood sugar levels regularly, and sometimes taking medication to help manage blood sugar levels. It's important to work closely with your healthcare provider to develop a treatment plan that's tailored to your individual needs. If you have gestational diabetes, it's important to follow a healthy eating plan to manage your blood sugar levels. Here are some tips on what you can eat. Focus on eating whole, nutrient-dense foods. This means eating plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit your intake of processed and sugary foods. Avoid foods that are high in added sugars, such as candy, pastries, and sugary drinks. Also, limit your intake of refined carbohydrates, such as white bread, pasta, and rice. Eat regular meals and snacks. Aim to eat 3 small meals and 2 to 3 snacks per day. This can help keep your blood sugar levels stable throughout the day. Pay attention to portion sizes. Eating too much of any food can cause your blood sugar levels to spike. Use measuring cups and spoons to ensure you're eating the right amount of each food. Work with a registered dietitian. A registered dietitian can help you create a personalized eating plan that meets your individual needs. Remember, managing your gestational diabetes through diet and lifestyle changes is important for both you and your baby's health. Be sure to talk to your healthcare provider about any questions or concerns you have. It is recommended that you monitor your blood sugar levels frequently throughout the day. Your doctor will give you specific instructions on how often to test your blood sugar levels, but typically it is recommended to test first thing in the morning, fasting, and after each meal. This will help you understand how your body reacts to different foods and how well your treatment plan is working. In addition to monitoring your blood sugar levels, it is also important to keep a record of your results and share them with your doctor or healthcare team. They can help you interpret your results and make any necessary adjustments to your treatment plan to keep your blood sugar levels within a healthy range. Also, if you've had gestational diabetes in a previous pregnancy, you're at a higher risk of developing it in future pregnancies. However, there are steps you can take to reduce your risk. Healthy weight. Maintaining a healthy weight before and between pregnancies can reduce your risk of developing gestational diabetes. Balanced diet. Eating a diet that is high in fruits, vegetables, whole grains, and lean protein, and low in processed foods, can help reduce your risk of gestational diabetes. Exercise. Regular physical activity, such as walking or swimming, can help reduce your risk of gestational diabetes. Talk to your doctor before starting any exercise program. Manage any existing medical conditions. If you have any existing medical conditions, such as high blood pressure or polycystic ovary syndrome, PCOS, work with your doctor to manage them before and during pregnancy. Get early prenatal care. Make sure to get early and regular prenatal care, which can help identify and manage gestational diabetes. Consider medication. If you have a high risk of developing gestational diabetes, your doctor may recommend taking medication such as metformin to reduce your risk. What are the long-term effects of gestational diabetes? The long-term effects of gestational diabetes can vary, but it can increase the risk of developing type 2 diabetes in both the mother and the child later in life. Women who had gestational diabetes during pregnancy have a 50% chance of developing type 2 diabetes within 5 to 10 years after giving birth. They are also more likely to develop high blood pressure, cardiovascular disease, and kidney disease later in life. Children born to mothers with gestational diabetes are also at a higher risk of obesity and developing type 2 diabetes. They may also have a higher risk of developing type 1 diabetes, metabolic syndrome, and cardiovascular disease. It's important to manage gestational diabetes during pregnancy to reduce the risk of these long-term complications. After giving birth, women who had gestational diabetes should be regularly screened for type 2 diabetes and other related conditions. A healthy lifestyle, including a balanced diet and regular exercise, can also help reduce the risk of developing type 2 diabetes and other related conditions. In conclusion, gestational diabetes is a serious condition that can have significant implications for both the mother and the baby. However, with proper management, it is possible to control blood sugar levels and minimize any potential harm. By following a healthy diet, getting regular exercise, and monitoring blood sugar levels as recommended by a healthcare provider, women with gestational diabetes can reduce their risk of complications and give their baby the best possible start in life. We hope this video has been informative and helpful to you. If you found it useful, please consider subscribing to our channel and giving this video a like. By doing so, you'll stay up to date with our latest content and help us reach more people who could benefit from this information. Thank you for watching, and we'll see you in the next video.